Hello, I'm Dr. Kim Abog, and I'm a naturopathic doctor and doula based in Toronto, Canada. So one question that I get often as an integrative fertility care provider and doula is if going through assisted reproductive technologies such as in vitro fertilization or IVF will put someone in higher risk category during their pregnancy. And the answer to that, short answer to that, is no. It will not put you through a higher risk category in your pregnancy automatically. But the research and more importantly, the individual experience of pregnancy are much more complicated than that. Now, in totality, there is a slightly higher risk of severe complications around delivery for people who have gone through ARTs compared to those who have conceived naturally. And complications may include postpartum bleeding that may require a blood transfusion, admission to an intensive care unit, reproductive tract infections, and in some very extremely rare cases, death can occur. Now, it is important to note that those who had less invasive fertility treatments, such as intrauterine insemination or IUIs, or ovulation induction with medications, were not deemed as high risk compared to other people who have been deemed otherwise. It is also very important to note that results of a large scale studies such as those that look at the relationships between pregnancy risk and reproductive technology use should be interpreted with a lot of care. And because severe complications that have been reported should not be overstated nor generalized, as it is such an individual matter. So totally understand it can be very tricky to communicate the science to someone who may have a completely different health history compared to the subjects in the studies. So that's very important to recognize. So for instance, there are underlying medical conditions like diabetes and other conditions that can significantly affect placental health that could be increased, that could have a higher risk in pregnancy, while if there is a history of using higher doses of hormones to stimulate ovulation for egg retrievals or implanting fresh versus frozen embryos. So those are very crucial factors to acknowledge as well. This is why it's so important to discuss potential risks associated with assisted reproduction and to try to minimize those risks with a plan that is tailored to the individual couple or just a person who requires care. So a plan can ideally look like interventions that potentially incorporate tools that help to minimize medication dosages, reduce side effects, optimize sperm egg quality or overall preconception health, and managing diabetes, and so much more. The possibilities can be endless. Now, if you found this video helpful, please feel free to like, share, and save. And yeah, share it to those who may benefit from this information. I'll also be making this transcript and general information available on my website in case you prefer a different format. But more importantly, if you are interested in working together in optimizing your fertility and pregnancy success and preparing in your parenthood journey, your postpartum care, please feel free to send me a message via my email or my website. And I really look forward to taking that next step with you. And I wish you well. And thank you so much for taking the time to watch this video.